Okay, welcome back, everyone. What we're going to be looking at is now some of these anatomical reference terms. Okay, these are important terms. It's important to get these down. You will see this for sure on some of the Connect quizzes. Um, you'll also see some of these terms come up when we cover muscles, when we cover bones, when you cover arteries and nerves, and you're going to hear these terms. For example, there's a muscle called biceps brachii. So here, when you see the word brachial, brachial means arm. When you hear brachial artery or brachial vein, you're going to know where they're located because you got to know the arm is brachium. The armpit is axilla or axillary. There is an axillary artery, an axillary vein, an axillary lymph nodes. So knowing that is important. Mental means chin. When we cover osteology, there's going to be two little holes right here called mental foramen. The term foramen means hole. So when you know mental is chin, the mental foramen is down here. Everywhere there's a hole in the skull, there's going to be arteries, veins, and nerves that pass through those holes. The neck is called cervical. That means neck. There happen to be 7 cervical vertebrae. The cheek is buccal. When we cover muscles, there'll be a muscle called the buccinator. And if you know that the cheek is buccal, you'll have an idea where the buccinator is. Cephalic means head. So when someone has cephalitis, they may have inflammation. Cranial means skull. Facial refers to the face. The eye is either ocular or orbital. Nasal is nose. And the forehead is called frontal. In fact, when we do the skull, when we do the bone, this is actually called the frontal bone right here. That's the frontal bone. We talk about the mouth, it's oral. When we talk about the belly button, it's umbilical. Talk about the abdomen, it's abdominal. We talk about the breast, it's mammary. And when we talk about the chest, they either use the word thoracic or thorax. And there are 12 thoracic vertebrae. There are 12 bones from here to here, just on the posterior side. This entire region is referred to as the trunk. For ear, we use the word otic. Otic is ear. So this has shown up in the past on a quiz, on the Connect quiz. And again, it's drag and drop. So we covered frontal. We know the eye is ocular or orbital. We know the nose is nasal. The chin is mental. The cheek is buccal. The ear is otic. Okay, so now we have an anterior cervical triangle and a lateral cervical triangle. Remember we talked about anatomical position. The palm was facing forward. I said the pinky was medial, the thumb was lateral. Lateral means it's away from the midline. So lateral triangle looks like it's referring to this here, and then anterior cervical triangle looks like it's referring to this here. And one of the bordering muscles is this muscle here called the SCM, which stands for Sternocleidomastoid muscle. We could see it here too. Sternocleidomastoid muscle. So there's an anterior cervical triangle and a lateral cervical triangle. Even if you didn't learn it, you could probably figure it out by process of elimination. Okay, the wrist. The wrist is carpal. You've heard of someone having carpal tunnel syndrome. So carpal are the 8 bones that we have in the wrist. The palm is called palmar. The thumb is called pollex. And the fingers are referred to as phalanges. Phalanges. And you have your first digit, your second digit, and the pinky would be the fifth digit or fifth phalange. In the groin region, here to here, this is called the inguinal region. More medial to that, where we have the two pubic bones, that's the pubic region. The thigh itself, this bone here is called the femur, the longest bone in the body, so it's the femoral region. The kneecap is called the patella. There's a base and an apex to it. The base is on top and the apex is on the bottom. The leg is called crural. The ankle is called tarsal, not to be confused with carpal. So we have 8 carpal bones, and you will learn 7 tarsal bones in the foot. In the hand, we had a pollicis or pollex for the thumb. Here, the great toe is called hallux. So the H, think of heel for foot. So hallux is the great toe. Pollex or pollicis, the P, think of palmar. So the pollex is the thumb, the hallux is the great toe. The foot itself is called the pedal foundation, or kind of sounds like the word pedal, like pedaling a bicycle. Cephalic is head, cervical is neck. Another word for the back is called dorsal. And another name for the front would be ventral. So the opposite of dorsal is ventral. Dorsal is the back, ventral is the front. Dorsal means posterior, ventral would be anterior. The back of the elbow, it's called olecranol. Then you have an upper limb, and if there's an upper limb, there's going to be a lower limb. The highest point of the shoulder is called the acromion or acromiole. That's the highest part of the shoulder. When here's the upper limb, then we have a lower limb. The glutes or the rump or the buttock is called the gluteal region. When we do muscles of the buttocks, there's a gluteus medius, gluteus maximus, gluteus minimus. So those are the glute muscles. So this is the gluteal region. The back of the knee, where we have this little crease or this little depression back here, is called the popliteal region. The calf is called sural. The heel is called calcaneal. And the bottom of the foot is called the plantar surface. So plantar refers to foot, palmar refers to the palm of the hand. Important landmarks to know. Some of the directional terms, superior and inferior, these are opposites. Anterior and posterior are opposites, and medial and lateral are opposites. So superior is above and inferior is below. Superior is when you're moving towards the head, and inferior is when you're moving away from the head. Anterior is the front of the body, posterior is the back. Another name for anterior, remember, was ventral, and another name for posterior was dorsal. They're opposites. Medial and lateral. Medial, just think of M&M. Medial is midline, close to the center of the body, and lateral is moving away. And I'll show you these on a picture as well. Proximal and distal are opposites, superficial and deep are opposites, and then contralateral and ipsilateral are opposites. So proximal and distal, proximal is when you're closest to the point of attachment to the trunk. Distal is when you're further away from the trunk. And again, I'll show you these on a picture. It'll be easier. Superficial and deep. Superficial is when you're towards the external surface of the body, and deep is when you're moving deeper into the body, away from the external surface. Contralateral and ipsilateral, I'll give you an example. If a patient hurts their right shoulder and their ipsilateral wrist, then it's their right shoulder and right wrist. If the patient trips and falls and breaks their right wrist and the contralateral ankle, then it's the right wrist and left ankle. So here's the terms, right? Superior is moving towards the head, inferior is moving away from the head or towards the feet. The terms proximal and distal are going to be related to the extremities for the most part. So distal is when you're moving towards the distal part. Proximal is when you're moving towards the trunk region. If we were to look at this part and just isolate the forearm, then this part here would be referred to as the proximal part, and this part here would be the distal, right? Really depends on what we're referring to. The proximal is the beginning portion, distal is the most distant portion. Same thing with the lower extremity. Proximal is the highest point, distal would be further away. If we're focusing on just the femur, this bone, then this would be the proximal part of the bone, and this would be the distal part of the bone. Medial and lateral. Medial means you're moving towards the midline, and lateral is when you're moving away from the midline. So the most lateral finger is the thumb, and the most medial finger is the pinky. The nose is medial, the eyes are lateral. The ears are most lateral. Okay? Looking from a lateral view, from the side view, again, we see the terms superior and inferior. Now we see anterior, which is to the front, and then we see posterior, which is moving towards the back. And the other name for anterior was ventral. The other name for posterior was dorsal. Now remember, we had these terms like proximal and distal, superior and inferior. When we're talking about what the skull and the gluteal region or the sacrum, we can say we're moving cranially to the cranium, or caudal. Caudal means the tail, moving towards the tail. Caudal, cranial. Okay, good place to take a quick break, see how everyone is doing.